Hi, I'm Dr. Peter Coleman. I'm a board-certified addiction medicine specialist who's retired, but I worked with patients with opioid addiction for over 40 years. And we're talking tonight about the second reason why opioids are particularly dangerous and difficult to deal with, and why people need to take their disease really seriously, and that's the fact that opioids are deadly. Alan was a patient that came in to see me when he was in 11th grade. His parents had found some hydrocodone in his drawer and started noticing a few changes, and we did an assessment and he went off to rehab. But he didn't stay clean for a while. After he got back out, he was back using again. He didn't take his aftercare seriously, and he went back to rehab. And I saw him off and on for about 6 or 7 years. At one point, we had him on Suboxone, and he did okay for a while, but he would drop out of treatment and start using again. He was a nice guy and just talented, and had a beautiful girlfriend and had a nice job. But his mother called me to tell me that he'd lost his battle with fentanyl. And sadly, he was only one of 250 people who died that day. That's how dangerous opioids are. 70,000 people a year was the latest figure, and that's actually down from what it was. We've known opioids are dangerous for a long, long time. There was an opioid drug called laudanum that was legal back in the 1800s. It had opium in it, and there were deaths associated with that, quite a few deaths. Morphine became purified from opium, and the death rate went up dramatically, and then it went up again when the hypodermic needle was invented around 1860. So bad that the Civil War morphine dependence was called the soldier's disease. Heroin was invented as supposedly a treatment for asthma, but around 1900, but it very quickly became abused and became such a problem that the Narcotic Act came in to try to control it. There were so many people dying. I used to have old patients in their 60s, and I would get their history, and I'd say, "Oh, now what drugs have you used in the past?" And a lot of them would say, "Oh, doc, I've used everything. You name it, I've used it. Cocaine, And I'd say, "Did you ever use heroin?" And they'd go, "Are you kidding me?" They knew that that was a drug you just didn't touch. You didn't touch opioids. It was too dangerous. They'd watched Jimi Hendrix and Janis Joplin and known about those deaths and stuff, so they knew just how dangerous it was. Opioids kill people because it shuts down the breathing. It turns out that we have a breathing center in our brain that keeps us breathing even when we're unconscious, asleep, and it keeps us breathing. It monitors the oxygen levels and CO2 levels, and it keeps us breathing. But for some reason, we don't even really know why, opioids slow that down, and at high enough doses, shut it off completely so that people stop breathing and die. That's why anesthesiologists who are doing surgery on people and giving them opioids, of course, monitor their oxygen levels and put oxygen on them if their oxygen levels start going down. Unfortunately, that doesn't happen out on the streets. People have no idea how low their oxygen's getting. It's just a sad, sad thing. Fentanyl, the death rate for heroin was bad enough, but fentanyl is 50 times stronger. And that's why there are so many deaths still today, is really because of fentanyl. So when I was in rehab, a guy called Kevin came in. He was an anesthesiologist from Maryland. And he was using fentanyl with his friend, his medical school friend, and his friend had died. They'd only been using for about 3 weeks. But his friend had overdosed and died off the fentanyl that they'd been stealing from the operating room. That's how dangerous fentanyl is. These were smart people, doctors who knew the dose. They had access to pharmaceutical fentanyl, so they knew exactly how much they were getting, how much to give, and his buddy made a mistake and died of an overdose. That's how dangerous fentanyl is. Imagine then how much more dangerous it is when you buy stuff on the street. The people who are mixing it up from a powder and putting it often in kitchen blenders and then selling it They have no idea what they were buying. They have no idea how powerful the end product that they're getting, that they're giving, that they're selling is. And there's such inconsistency. Even trained pharmacists, with scales and the right equipment would have a very difficult time measuring a safe dose, because the dangerous dose, the fatal dose of fentanyl is often 2 milligrams. So if you've ever seen a baby aspirin, which is a tiny, tiny little pill, that's 81 milligrams. So imagine cutting that into 40ths and then taking that, and that's a fatal dose. So you've got to take less than that. It's such a dangerous thing. The bottom line is that people using street drugs these days are playing Russian roulette. They have no idea exactly what they're buying. The consistency from one day to the next could be twice as strong, 3 times as strong, half as strong. And so that's what we're up against if people are using opioids. Opioids are especially dangerous after any period of abstinence. As we know, tolerance goes down, really back to 0, so that a tiny dose is dangerous again. So people underestimate that. They think they're just going to use half as much or a smaller dose, and they still overdo it. As an example, I had a patient who was a family practice doctor from West Virginia who came in, and he had been in treatment and he had been clean and sober for, I think, about 10 months, but he relapsed. And he was smart. He knew not to use too much because he knew his tolerance would go down. So he only used 20 milligrams of oxycodone, and he only snorted it. He that was only a quarter of what he used to do. He still passed out in his car for 5 hours. I don't know quite how close he came to dying, but he came pretty darn close. The last way that opioids are so dangerous is when people mix them with sedatives, which unfortunately happens all the time. That includes alcohol, it includes Valium, Xanax, any of the benzodiazepines. Probably 50% of all the overdoses that happen, it's a combination of opioids and sedatives. People have no idea how dangerous that combination is. It turns out that sedatives slow the breathing down as well. So when you have opioids slowing it down from one direction and sedatives slowing it down from another, it's one of those synergistic things where 2 and 2 is more than 4. So it's especially dangerous. The main message here is it's such a dangerous thing. Get into treatment as fast as possible. If you know anybody who's still using opioids, get them into rehab as quickly as you can.